So that's a good question. Can a low carbohydrate diet send it's, and remember we're talking about type 2 diabetes here, it's really important. This isn't type 1, it's type 2 diabetes into remission. And so I'm going to, this is quite basic, but some of you may have already done this. I'm sure some of you have, but for those of you who don't know about it, I'll just run through this quite quickly. What happens to food when we eat it? Well, we get most of our energy in our food from carbohydrates, and that includes sugar, and we shorten that to carbs, also from fat and from protein. But carbs are the only part of food that directly increases the blood glucose levels. So even if you don't eat any obvious sugar, your carbohydrates are going to increase your blood glucose levels. And that makes our pancreas, the pancreas makes insulin. And in type 2 diabetes, our pancreas is still making insulin, at least it is in the first few years. So the pancreas makes even more insulin. But you have this thing called insulin resistance going on in type 2 diabetes. And that's going on for years before you even know you've got diabetes. But if you then eat loads and loads of carbs, your insulin resistance is even going to increase, which makes the insulin work harder to get the glucose in your blood into your cells of your body. So if you cut down on your carbs in your diet, you can get energy from other places. Because people always say, oh, if you don't eat many carbs, where are you going to get your energy from? Well, you can do. You can use stored body fat for one thing. And that is one of the big benefits of cutting right down on your carbs. You start to use up your own stored body fat. And as many of us know, one of our problems is that we usually have too much stored body fat, especially around our middles. And this is the slide from a very famous English doctor called David Unwin. Loads of you will have heard of him. And he's in Nottingham, and this is just one of his slides, which is in the public domain, of one of his patients. And this is showing the patient's weight, and it goes back, look, 20 years, that's 2005 to 2017, so that's 22 years. And this is what happened to this patient's weight. And the patient was diagnosed with diabetes. I'm not sure exactly when, probably here, because type 2 diabetes usually goes along with being overweight. And the weight stayed up, that's 90 kilograms. But when he was younger, he only weighed 74 or even 72. So his weight went right up as he got older, and he was diagnosed with diabetes, went on lots of tablets. He went on blood pressure tablets too, and probably cholesterol tablets, because you often end up on all of them. And this is his weight. He's trying to lose weight, up and down, up and down. You know the story. It's really difficult, isn't it? With you lose weight, you put it back on, you lose weight, you put it back on. But at this point, he joined Dr. Unwin's clinic, and he gave up sugar and lots of his carbohydrates. And look what happened to his weight. For goodness sake, look at that. And at this point, this gentleman was on insulin injections as well. He is a type 2, he's not a type 1, but he was on insulin injections. But when he got to this point here, he actually came off his insulin. And this HbA1c, if you don't know, this particular slide shows someone who'd had diabetes for many years, and he ended up on insulin, as people often do. But when he joined this clinic at Dr. David Unwin's, and he cut right down on these carbohydrates as well as the sugar, he lost loads of weight, and he actually ended coming off his insulin and reversing his diabetes, so that his long-term blood sugar test, which is called an HbA1c, was below the level where you have diabetes. So he came off the insulin. He also came off the tablets such as glyphosate, and he came off blood pressure pills as well. So it's a double whammy, a triple whammy, because most people come off cholesterol tablets as well. So this slide, David Unwin's again, it shows the equivalent teaspoons of sugar in carbohydrates. So if you eat 150 grams of basmati rice, but frankly, it could be any sort of rice, including brown rice. If you eat 150 grams of that rice, it's the same as if you ate 10 spoons of sugar, because that's what it does in your bloodstream. Once it's digested, 150 grams of rice, basmati or any sort, is the same as if you sat there and you put 10 spoons of sugar into your mouth. That's what it does in your bloodstream. If you ate 150 grams of a potato, which I've measured a potato, 150 grams of a potato isn't a very big potato. That's the same as if you ate 8 spoons of sugar. And so it goes down. You're going to get this. So it's really interesting. It has French fries, it has spaghetti. They all put up your blood sugars loads, as does sweet corn, sadly, because you think that sweet corn, being a vegetable, might not be too bad, but it puts your blood sugars up a lot. Bananas do. Bread does somewhat, but if you have one small slice, you're okay. But at the bottom of the list is eggs, which don't put up your blood sugar at all. So this is a really good chart to have a look at. And this picture here shows, and I'm going to tell you about a really good book if you haven't already got it and you're interested to get. If you want, we talk about trying to eat less than 130 grams of carbohydrates a day if you want to lower your blood sugars. 130 grams. And you're probably thinking, how do I know what 130 grams is? Well, on this picture is 4 plates and it shows what 50 grams is. So 50 grams of carbohydrate, which is a third or less than a third of what you should be eating if you want to reverse your diabetes, is it's either 3 slices of bread, 3 potatoes, a small amount of spaghetti, or a small amount of rice. But if you ate 50 grams of carbs, you could have loads of courgettes, peppers, tomatoes, healthy vegetables like that, mainly vegetables that grow above the ground. You could eat blueberries, strawberries, raspberries, quite a big plate, and you could eat nuts, and that's the same amount of carbs as a very small amount of bread or spaghetti. So it's about doing swaps. So if you wanted to do this, if anyone wants to do this, importantly, you need to speak to your doctor or your diabetes nurse or practice nurse, because you may be on tablets or insulin that you need to be very careful about taking them. If you cut right down on your carbs, you're going to need less diabetes tablets, you're going to need less insulin, right? So don't do it without speaking to your doctor or your diabetes nurse. And we're talking about less than 130 grams of carbs a day. And using the Carbs and Cows World Food Book, there is a picture coming up called Carbs and Cows World Foods Book, which has a lot of South Asian foods in it as well, shows how much carbohydrates is in all the different foods. And the other thing is to eat real food. Now, you probably all do. I'm sure you all do. But lots of people, especially younger people these days, eat a lot of processed food, takeaway food, ready meals. And these are actually not particularly healthy. So try and eat what my grandmother never ate food like that, real food, not processed or fake foods, and actually to include healthy fats in each meal. So that means proper butter, proper cream, and full fat yogurt, not to go low fat with your fats. I know we've been taught for many years now to actually use low fat of everything, but we now know that actually that probably isn't a good idea. We're not talking about eating a lot of fat, no, because there's loads of carbs in it. But when you do eat fat, use healthy, real fats such as butter, cream, full fat milk, full fat yogurt. And if you're eating less carbs, you do need a bit more of the healthy fats than you would normally eat. The Carbs and Cows World Foods Book, you can buy it off Amazon, and it's it's a brilliant book, and it's just showing you the different carbohydrate effects of dosa or masala dosa or string hoppers. Basically, small dosa is equivalent to eating 8-9 spoons of sugar. It's got 40 grams of carbs. A masala dosa is equivalent to eating 280 grams of carbs. So we talked then about, it's 280 grams. It's equivalent to eating 68 grams of carbs. So you have one of those and you're well over half your daily allowance if you're going low carbs. And if you have string hoppers, it's equivalent to 75 grams of carbs. And it doesn't look a lot of food to me. So that eating one lot of that is more than half the carbs you should eat in a day. And this book is really good because it's all pictures. So it really helps you give an idea what you're putting in your mouth. And that's the end of those slides.